Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You're watching Conversations with Jennylyn, and as always, I find fascinating people around the world to share with you. And today, I have another one for you, another fascinating person, and we're going to bring you some fascinating information. And hopefully, like me, you'll be smarter after watching this. Today, my guest lives in Germany, Cologne, Germany, and his name is Georgios Matis. And George, I am so grateful that amidst all the craziness in the corona world, that you took the time to spend with me. Welcome to my show.
My pleasure. Thanks for having me.
Sure. Now, what exactly are you doing in Cologne?
So I'm a neurosurgeon. I'm working in the Department of Stereotactic and Functional Neurosurgery in the University Hospital of Cologne here in Germany, under the guidance of Professor Fischer Vadevalle, a world expert in deep brain stimulation. And we're doing operations in the neuromodulation field. I'm not sure that you've heard of it because many patients and sadly many physicians are not aware of this option. Have you heard of it?
No, I have not. So I am hoping that when I am through with you today, it's a new topic. I can have a discussion with the appropriate person at some point. Please tell us about it.
Okay, to put it really simply, neuromodulation is an alteration of the nerve activity through a stimulus. It could be an electrical stimulation, or it could be a chemical agent, a drug, an opioid or non-opioid. Actually, what we are doing is to insert leads or catheters in the body, in the vicinity of the nerves, and try to modify the activity of these nerves. To give you an example, we can treat patients with chronic pain, failed back surgery syndrome, for example, spasticity, Parkinson's disease, dystonia, epilepsy, genitourinary problems, and many, many more.
That's fascinating.
I know, that's why I'm doing it.
Oh, I'm so thrilled that I got to do this interview because it sounds like it's something new. Well, it's new to me.
Unfortunately, it is not new. We are performing, at least here in Germany, these operations since 50 years. This is nothing new. But as I already said, there are many colleagues who haven't heard anything about it. And this is really sad because we could help many, many patients, especially now in this opioid crisis era.
Well, let's start. Let's spread the word.
I would like to keep it simple. There are many operations or many options that we have, but the two most important ones for me, because I'm working in the pain and spasticity sector, is the spinal cord stimulation and the intrathecal therapy. The spinal cord stimulation is the implantation of one or more leads, electrodes, in the spinal canal, in the vicinity of the spinal cord. There, we give electric current and we stimulate the nerves. This is a trick for the brain. The etiology, why the patients are having pain, is there, but the brain is not taking notice of it. It's a trick, it works, and it's wonderful. The second therapy, the intrathecal therapy, is the implantation of a catheter in the spinal canal very deeply, where our cerebrospinal fluid is, and we can give there directly many drugs. Of course, we're talking about neurostimulators.
Yeah.
Imagine a pacemaker for the heart, something similar, and we're talking about medical pumps. Many people are not so willing to have such foreign bodies in their own body, but when they see the pain relief that comes through these products, medical products, they are really satisfied. Not all of them, but I would say at least 80% of them.
Are you aware if they are using this form of treatment in the United States?
Of course they do.
Oh, they are?
Of course they do. Since many, many years, but I think in the United States, the colleagues have exactly the same problem. It's not very well known. And please let me take this opportunity now. If somebody is hearing us and has pain or spasticity or other neurological problems, could very easily visit the website of our International Neuromodulation Society at neuromodulation.com, or even visit the official journal of our society, Neuromodulation Technology and the Neural Interface, and can get many information, piece of information about the diseases and the possible therapies.
Would you repeat that again slowly so that they know how to find you? I will try to make a tag for it as well, so that it will
So
be...
the link is neuromodulation.com. It's easy.
Okay,
Neuromodulation.com.
neuromodulation.com.
And if somebody visits this website, he has the option to visit our journal as well.
Oh, okay. So when you asked me if we could include it in today's discussion, I thought it was brand new. I thought it was a new form of treatment. I didn't realize it's been around for 50 years, because I tried to find some information on it last night and I was not successful.
This is strange because the colleagues in the United States, at least, are doing a great job. They are making many webinars. They are organizing many webinars, many congresses. They are speaking to the press. I see every day interviews on internet as well.
Yeah.
So they are trying to spread the word to increase the awareness about these therapies. Apparently, it's not enough. They have to do more things. And the same is here in Europe.
Well, you know, with
Let me
medicine,
tell you, a big problem of this therapy is the cost. It's an expensive therapy, but if we select the patients correctly, and if these implants, these foreign materials stay in the body of the patient for 3 to 5 years, then it is a cost-effective option. So also the insurance companies and the society in general benefits from it.
3 to 5 years is all it lasts?
No, 3 to 5. If this therapy stays for 3 to 5 years, then it is cost-effective.
Oh, okay.
Usually, the patients receive these leads or these catheters, and they have this lifelong for the rest of their lives.
That's wonderful.
This is a marriage.
And yes, and so all of the cases that you're aware of have been successful, or have you had some failures?
No, I cannot say that. I already told you about 80% of the patients profit from these therapies.
Okay.
There is also a 20% who is not satisfied. This is why we are doing these trials. We are testing. We plant only the leads or only the intrathecal catheter, and we are testing. If the patient is satisfied, if a pain relief is there, only then we go ahead and we plant the neurostimulator or the pump.
Got it. For some reason, I missed that earlier when you told
No, it is really important to clarify it.
Yes, no, because if there's someone out there that could benefit from this, that is watching this show, I hope that they can find a practicing physician who can help them with this, but most importantly, that they could afford it.
This is the goal, and now it's a good time with this corona crisis. We have lots of time. We have time to look around on internet, to call colleagues or friends and get more and more information. There are millions of people with chronic pain who are waiting for a therapy, and they are not aware of these therapies. It's really sad.
Well, I know you have a different medical system. Do you have socialized medicine in Germany?
Yes, the majority of the population is covered from the government.
Okay.
There are also private insurances as well. And in the next years, the percentage is going to be much greater with the private insurances, but the majority of the population is secured, socially secured through the government.
Okay, and would the government cover a procedure like that in Germany?
Till now, the government or the insurance companies are paying for these operations as long as we can prove that the indications are correct.
Aha, I understand.
This is the reason why we are writing articles. We have guidelines, we have algorithms. If we stick to these algorithms and these guidelines, then we have no problem. The patients benefit from these therapies, and the whole society as well.
And it doesn't matter how old you are. You can.
No, it doesn't matter how old you are, but the sooner the better, because the pain can be saved, I put it simply, in our brain after some years, and then it is really difficult to erase this pain. We have examples of patients after 20 years that are getting a pain relief, but I would not suggest it.
Okay.
So the sooner, the better.
And what would be the perfect candidate for this procedure? What type of patient?
The perfect candidate is a person with back pain or leg pain after an operation in the spine. This is the so-called failed back surgery syndrome. This is the best indication. We have written many articles about it. A second group are patients with complex regional pain syndrome, CRPS. This is a really bad condition. The people have really strong pain, and spinal cord stimulation or DRG. This is another option. I don't want to say more things, it would become complicated, but this dorsal root ganglion stimulation as well could be another option to provide a very good pain relief. There are also other indications, for example, the peripheral arterial occlusive disease, when our vessels are too narrow and not enough blood is coming through these vessels, or patients with angina pectoris, so pain in the chest, and they tried drugs, they tried stents, they tried bypasses, and after all these things, they still have pain. Then we could help.
Okay.
But
Great.
it should become clear this neuromodulation is not a one-man show. It is only one of the options in the pain management. The patient should always try with tablets, with medicaments, with plasters, maybe, should try with physiotherapy, with all these things. And when these things do not provide adequate pain relief, then the next step could be neuromodulation. Not very early, but also not very late.
Why wait? Why not go ahead and treat them with that therapy to be better?
You should become a doctor. But the reason is simple. There are patients who can profit can benefit from the physical therapy, for example, and the combination with simple drugs.
Okay.
And they're fine. They don't need any more. Why should we plant something in their body if they're okay only with physiotherapy?
Okay.
But the majority of the patients who are seeing in the outpatient department are not these patients, are patients who have been years long around. They have tried all possible drugs, they have tried all physiotherapies, cognitive therapy, psychotherapy, and different other therapies, and they still have pain. This is our target group.
You're the last case resort.
Exactly.
But I understand.
Then we must succeed.
Right. I understand though, because most people wouldn't want something implanted in their bodies unnecessarily.
I wouldn't neither, but I've seen the results, the outcomes. And now, as a physician and as a patient, I'm convinced that this therapy can really help. It's not about implant something or wanting to sell something to someone. We are really aware of the cost of this therapy. We are really aware of the possible contraindications or the possible problems after this therapy.
Mm-hmm.
It's an operation, it's a surgery, but the benefits are really good and justified the very small risk.
That's great. I'm very happy.
It's a minimally invasive procedure.
Right, because I know of young people who've given up on life because they have chronic back pain issues and they tried everything, it hasn't worked. So hopefully in the United States, they will make it affordable so that some people can get treatment who are chronic patients sitting around giving up at a young age.
And avoid taking on the long term opioids.
Oh, you know, we have a crisis here in the US with that. I would imagine it's true in most countries.
And then we have not only the physical problems, the back pain, for example, but we have psychological problems and social problems as well. And when all these factors come together, then it's really difficult to treat the pain, because pain is something subjective. We cannot prove it. We cannot measure it. And it is very difficult. It's really affected by psychological factors. And these psychological factors improve the outcome as well. This is why I said neuromodulation is only an option. We are team players. We are playing with our psychologists as well, with our physiotherapists, with our anesthesiologists, who are here in Germany at least the right person for the drugs. So we are putting the leads, the anesthesiologists are doing the pain management with drugs. It's a teamwork.
That's wonderful. Are you in private practice?
No, I'm working only in this university hospital, but it's enough. The number of patients is good. We're a reference hospital. We were the first hospital in Germany who started doing these operations many, many years ago. We have a huge tradition in this department. There are many physicians who have been educated here, and now they're in other hospitals, and they spread the word about neuromodulation. Some of them also have left Germany and are working in other countries now.
You told me before we got on camera, before we started recording the show, that you are Greek. Did you grow up? I'm
coming from Thessaloniki. This is a town with 1 million people in the northern part of Greece. I completed my residency in neurosurgery there. But then I started moving around. In 2012, I was in the United States. I was in New York, in Weill Cornell Medical Center. There we have a very good skull-based lab under the direction of Professor Stig and Dr. Bernardo. I was there for 6 months. It was really amazing. And then 2012, I was in the University Hospital of Zurich in Switzerland. I received a scholarship there in the Department of Neuroradiology.
Wow.
With the Professor Valavans. I stayed there 1 year. I learned lots of things. And now I'm here since May 2014 in this department. And I'm very proud of being here.
And I'm so proud of all of your accomplishments. Congratulations.
Thank you.
Very impressive resume. So, is that your favorite place to work?
Yes, I really enjoyed it. I'm really lucky. You know, it's not always easy to have a job and at the same time like this job.
You're so lucky.
I'm privileged to have such a work. So
yes.
When I wake up in the morning, I'm not saying, oh, yes, I must go to the work. No, I enjoy coming here.
That's what we all want. We want to wake up and go, I can't wait to go to work because I get to do what I love. I love doing this, so I understand how you feel about your job. I think
it's passion.
Yes, it's so important to love what you do every day because you spend most of your day, most of your waking hours doing that. So thank you to you for all the people and all the ways you help people's lives. So how is Corona affecting your field of work, if at all?
It is really affected because the majority of our operations are elective operations. So we are obliged to have to keep our beds open, free for these Corona patients. At this point, I must say that the situation in Germany is not that bad. It's not so good, but also it's not that bad. In comparison to other countries, we are really good. So Germany has a population, just to give you some numbers, of 80 something more million.
Right.
Who have till yesterday 100,000 confirmed cases of coronavirus. We had till yesterday 1,600 deaths.
Wow.
70% of these deaths were people over 70 years of age.
Okay.
But we have also 33,000 people who are okay after the infection with corona. So they are cured, let's say. But what is really important is that the majority of the patients who are confirmed cases are young people, between 15 and 59 years old.
Wow.
This is 70% of the cases.
Very different from what's being reported in other countries, because they're claiming that most of their fatalities and infected patients are usually older people. Why do
Exactly.
you
The
think?
fatality means who is dying. In
Right.
Germany as well, the majority of deaths are in this age group, over 70 years of age. But the people who are infected are also, the majority of them are younger people.
Why?
This is why we're telling the people they should stay at home. It doesn't matter if you're young, if you're healthy, you could get corona. You should be careful.
I think a lot of young people think they're invincible, and that because they're not older, that they can't get it.
This is the definition of youth, thinking of being invincible, but they are actually not. And they have an obligation to the society to stay at home so that they can protect the elderly.
Yes.
It's true that the younger ones would probably maybe not understand they have corona. It could be very mild. The symptoms could be really mild. But the real problem is that these young people could spread the virus, could transmit the virus to the older ones who have heart problems, renal problems, lung problems, and they have not this luxury. If they get admitted, they would probably to a hospital, they would probably end up in an ICU. And this is the reason why we keep our beds free. And this is a great advantage of Germany, who have many intensive care unit beds.
Got it. So, do you know if the people in Germany were given the BCG shot at any time? Or they have? Is that compulsory that you get that? So I grew up in South America and I was given the BCG shot.
You're lucky.
And what I have noticed is that the people where I grew up, in most of the Caribbean, where you are given the BCG shot as a child, they haven't got as many infections and as many deaths.
I think I saw today an article saying something like that. I must find it.
Yes.
People who have this BCG are more protected.
Right. So yesterday, I interviewed a doctor from the Netherlands and Belgium, and I brought this up with him, and he said, there's a lot of talk about it, but they haven't had studies to prove it. Do you believe that it's playing a part in people's immune systems if they were given the BCG shot? Are you buying into that idea?
It could be, but I'm a scientist. I need data. Without data, without articles, without publications, without a very good statistical work, we cannot say anything. It could be so. I'm coming from Greece. The cases there are much lower than here. And in Greece, everybody gets this vaccine.
Yes.
So it could be true.
Yes, in the United States, they weren't given that because I always test positive whenever they test for malaria because I have that shot. And it's always been something I've been angry, like, why did I get the shot? But now I'm happy I have it just in case it turns out to be true, that it's helping the immune system.
I think it is good, but we have to search much more. So there are many factors that are playing a role. We should find most of them, if not all of them.
Right. Are you? Do you believe that we won't have a vaccine for this virus until next year?
I think it's a matter of time. We will get a vaccine. The problem is the mutations. As with the influenza vaccine, you cannot be completely secure. There are always mutations, and you are not always 100% protected.
I'm glad you were bringing this subject up because I'm someone who's never had a flu shot. I just refuse to take them because I try to maintain a really healthy lifestyle, eat well and all this. But the reason I haven't wanted to take it is because they guess the mutation of a virus when they make a vaccine. Am I correct?
Yes, it is correct, but the chances that you get protected from a virus are much more than not being protected. This is why we're doing it. We suggest that all people should do it.
Yes, so this
care providers mainly.
So this vaccine is sort of, this virus is sort of elusive. So what you're saying is you will have a vaccine, but by the time that vaccine is available, the virus may have mutated into another virus.
It has already mutated. We know that there are mutations of the virus, but I'm actually much more worried about the financial consequences of this virus rather than the consequences in our health. I think it's not such a huge problem as we see it on the media. It is a difficult situation. The victims are much more, the dead people are much more than from influenza virus every year, but it is not that bad if we are all careful.
It seems like it's going to be around for a long time, keeping us on our toes.
I think so, and here in Germany, of course, all the restaurants are closed, the schools as well. And they told us, I have 2 children, the teachers told us that the schools are going to stay closed till April 19th. But in 1 week from now, they should decide what's going to happen next. And I think they're going to stay closed at least for 1 more month, at least.
I think we have to. I think we have to take as many precautions in terms of letting people back out, because you don't want to have a repeat performance. We don't want to have another huge outbreak because we're just really not accomplishing anything trying to rush back out. What do you think about that? I mean,
we should first prove that the number of the infected cases is stable and becomes lower and lower every day. This is the first step. Only then can we say, okay, we can remove some measures, we can a little bit be not so strict about it, but we have not reached that point. It could be dangerous to sacrifice what we have already done till now for 1, 2, 3, or 4 weeks.
So people I've spoken to globally have shared with me that the people are dying so quickly, and because of the quarantine, they can't have normal funerals and they can't put their loved ones to rest the way we do it traditionally. How are they handling the deceased in Germany?
In Germany, as I said, it's a huge country with 80 million population. 1,600 deaths is nothing. So with all respect to the people who have died and their families, but if somebody looks only the numbers, it's not a problem. In other countries, as in Italy, I have many friends, many colleagues who are working in Italy right now. It's a disaster. The system has reached its limits.
Well, they have had, it sounds like they've been hit harder than most countries.
Italy and Spain, and unfortunately the United States as well, are going to be a big problem.
Why do you think that is? Why do you think some countries are being just bombarded with these cases, and other countries, they seem to have it more under control?
It could be two factors could play a role. The first factor is, as soon as we know that there is a virus, we must take some measures. There are countries, as Taiwan, for example, or Korea, which take these measures very quickly, or Japan, and they stick to it. This is why the results are really good. But there is a second factor. There are many cases, and I think New York, for example, is a very good example, where the hospitals were already full with patients before this crisis. So if you have a hospital full with patients, and then you have an epidemic, where should you admit these patients? You don't have any beds. You have already reached the limits of the system without the pandemic.
As a doctor and a treating physician, what have you learned from this that you would like to share with us?
I said this, I learned that we should trust more each other. I learned how important the family is, the support of the family, but I also learned how technology, internet, or the social media can help us. We can stay together, although we are not near one to another. You are sitting in California, I'm sitting in Germany. And nevertheless, we're having this discussion, hopefully an interesting discussion, and it's as two good friends drinking coffee.
Have you noticed I haven't coughed?
I'm healthy too.
Making sure I don't contaminate you.
Now we're far, far away, at least 2 meters away.
I had a conversation with the screen. I said, protect him. He's a doctor. We can't get him sick. So what are you doing now since you know, I don't know if you're quarantined or if you're still seeing patients. I know you can't operate because like you said, your surgery.
We operate only the emergencies.
Oh,
so if a lid or a catheter is dislocated, or if a pump is empty, if the battery is empty, we have to make these operations, but we are not performing any elective operations.
okay.
This is a good time. The hospital is trying to protect us. This is why we are trying 1 week to stay at work and do we have also many bureaucratic things to do for the insurance companies, many letters to write, but we try to do it in a row, changing. 1 week we stay at home, 1 week we go to work, trying to minimize the possibility that we get also the virus.
Apart from this, I've done marketing over the years, and a lot of my marketing jobs are to physicians. I'm speaking to quite a few of them now, and they don't quite know what to do with themselves because they are at home. And you know, you physicians, you go, you're always busy. When you don't have any cases or any insurance letters to write, do you find yourself wondering what to do with your time, or are you always busy?
No, but this reminds me of many colleagues who retire at the age of 65, 67, and then suddenly they don't know what to do because they don't have any hobbies. And it becomes worse. Their wives or their husbands have also problems because they don't know what to do with their partners after so many years. But no, I don't think I have such problems. There are always things to do. There are things to do at home, with the family, with the kids. One can study with them, can watch a movie with them, can play something with them. You can always write an article. You can always search in internet, prepare articles for the future. You can prepare webinars. You can do such things that we are doing right now together and spread the awareness about the therapy. Otherwise, I wouldn't have the time to do something like that with you. So I don't see it as a waste of time. I see it as an investment. We are trying to stay safe. This is the first goal, the most important goal. But at the same time, we're trying to use this time in a very clever way and do things that we otherwise wouldn't be able to do.
Thank you.
But hopefully this won't last many, many months, because then it's going to be problematic. There is a huge number of patients who are waiting to get an operation, and they should get operated. We cannot wait forever.
I understand. Are you going to be coming to the United States anytime soon to visit?
If I get an invitation.
Well, you're invited. Why don't you come?
No, this is not planned. This is not planned. I think the first priority now is when we're all over with this disaster, to start working really intensive here in the hospital and start operating a lot.
Okay. I asked you that because there are lots of sports medicine doctors out here I'd love to introduce you to. I don't know if they are offering the service that you and I discussed earlier. I think there's such a huge need for it. I actually worked for a spine center once, and they were using a system called DBC for the patients, for the chronic back pain patients. But I think it would be wonderful to integrate what you are offering into the clinics like those, where they could send them to you and work with you.
They are always welcome. All colleagues from all around the world are very welcome here by us. We can show them what we are doing, mainly show them the indications. So this is the most important part, the good indication. We can show them what we are doing in the operating room, and we can help them after that when they go back to their countries. If they have any problems or if they need advice, they can always contact us, and we can provide them with information. And one more thing, during this time, I was a little bit active on Facebook. There, I met lots of people from India or from Pakistan, colleagues, neurosurgeons, who are very interested in neuromodulation. And it could be that in the future, when the whole story of coronavirus over, is that they could come to us here for a fellowship or for 1 week just to see what we are doing. Or even more, we are trying to start in a scientific collaboration. We start writing articles together.
That
So
is
there are many opportunities that are given through the social media.
Would you allow a television crew in your operating room? I've gone into a few operations and done segments so people can see how these procedures are performed. Are you open to doing interviews like those while you're operating?
This is not my decision. We have to get the approval of my director or of our hospital, but I don't think this should be a problem.
Well, that would be a great show people how it's done. Although sometimes you're better off not knowing and just go to sleep and have them do it, and then you wake up.
The people should always, the patient should always be very well informed before the operation. They should know what is to expect, what could go wrong, what could go right.
Okay.
We must inform them. They must be very good informed.
I am so grateful to you. And you know, the corona is really working out for me because it's affording busy doctors like you time to share these, to share all of your expertise with me. Unfortunately, our time is up, and I wanted to know if there was anything I did not ask you that you would like to leave with anyone watching this show. I want to make sure we get all of the pertinent information out there for them.
Now I think we said the most important things, but what I would really like to stress is that everybody is responsible for his or for her own health. The patient should not wait from their physicians or from friends or from colleagues to get a solution. They should become active. Now with the social media, with the articles, with the books, there is so much information out there. We must simply ask for it and try to seek it. It is unbelievable that there are millions of people there with chronic pain and other neurological problems who could benefit from a variety of therapies, and they have never heard of it. This is once again why it's important to become very good informed, to visit our official sites, the International Neuromodulation Society, for example, or the national chapters in its country, and get informed. The last thing that's really important in this corona crisis era is that we have enough toilet paper for everybody. Really important, especially here in Germany.
Perfect ending. I was saying we need the humor. And that's what gets me through the days, apart from speaking to wonderful people like yourself.
It is a defense mechanism.
Thank you so much. I hope I can do another segment with you sometime when you
My pleasure.
continue to share with us.
We'll do it.
Great. Enjoy the rest of your evening. Sweet dreams. And I'm very, very grateful to you. And I'm hoping people will gather a lot of inspiration and knowledge from this segment.
I hope so. Thank you very much for your time. Have a great day and stay safe.
I promise. And
Thank you very much.
for watching the Jennylyn show. Sorry, thank you for watching Conversations with Jennylyn, when a conversation is all you need to be inspired. Take care and thank you.
Thank you very much.
Thank you. I'll be in touch with you.